CHC is about a love for our community. It's about wanting people to live healthy and productive lives and reaching their potential.
What it represented was an opportunity to initiate a community-oriented effort that could, over the years, provide a voice for the community.
I think the way that we look at empowerment is really more about engagement. I believe people are empowered. I believe that they do have power. I think we try to wake that up in them to show them that there are ways in which they can make a difference, that they really can have an impact.
Well, the fitness center had become a loving community that people of the neighborhood belonged to.
It was a community, it was a family. And if you weren't there, people would call you up and say, "Where are you? Are you okay?"
So we heard that the fitness center was going to be closed.
We were just people coming to exercise, and the CHCA said, "Hey, in unity there's strength."
We met at the corner of
Grace and Prairie.
yeah, right under the big Daniel Freeman Hospital sign. We care, you know. But anyway, we met under that, and the TV news was there and the whole thing.
Well, I think it's important for everyone to have health care coverage, really. You know, everyone needs it. But I think that the most vulnerable segments of our population are children, seniors, and I think it's really important that they, have the medical care that they need.
Me impidió tener seguro médico porque me pusieron con un costo muy alto, el cual yo no puedo pagar porque nuestro salario no es muy alto. Entonces, por eso tuve que buscar alguna aseguranza la cual fuera más económica para poder pagar yo, y Healthy Family fue la que.
So CHC has helped with the ABC program, with the health insurance enrollment of our families. And again, this is hundreds of families every year that are enrolled through the ABC efforts. And also just working with a coalition of agencies that CHC spearheads just to work on social justice issues, work with politicians in Sacramento and local legislators to address the health needs of our communities.
They have a tremendous potential to sustain a lot of the programs currently in place. For example, with healthcare reform, this is just the beginning. Healthcare reform is a 10-year strategy that actually will carry us into the next 50 years. CHC has a great vision about how to convene the stakeholders, including patients, to be able to design a system that will last beyond the 10 years of healthcare reform.
You know, when CHC speaks, I think that, our political representatives and others listen because they have credibility, they have legitimacy, and they know what they're talking about.
The Community Health Council is a very effective communication tool for the needs of South Los Angeles into the policy world around Los Angeles and around California. At the same time, it is a very effective tool to bring opportunities for South Los Angeles back into the region.
Once I came in contact with CHC and the Greater Baldwin Hills Alliance, I became so much better informed about things. They were out there in the community working. They were engaged in legal procedures, and they were very much concerned with the environment, placing signs out, holding press conferences, and doing many things that we could see them doing and we could see the results of.
CHC also has stature with civic and community leaders, and that gave instant credibility to the effort to create a coalition that really wanted to have some long-lasting effect on the operation of the soil field, and we think we did.
The CHC programs are wonderful. CHC has been at the forefront of much of the research on nutrition and health and the food environment.
They are available, they are approachable, and they're there to help in any way they can.
Also, Community Health Councils is just an important spokesperson. Nutrition in the neighborhoods, access to groceries. Community Health Councils has been there to help lead the campaigns, to help push and pull the community toward a healthier state.
And I think a lot of change models or community work has people from the outside coming in saying, we know what your problem is, let us fix it. And I think Community Health Councils takes the approach that the community should determine what their problems are and how they want to address those problems.
We need CHC so that we can be better informed. And this is a completely new level for me. And it's gratifying in many ways that I am able to join with the organization and be out there doing things.
Well, if you're talking about planning issues and community folks have never sat in a planning meeting before they're put in that position, giving them an understanding of how the process works. So I think it's very much capacity building, it's very much kind of community health literacy of another sort. Again, giving people an understanding of how maybe the professionals talk about some of these issues such that they can have more credibility when they have these conversations.
But to know that something can be done and that we are working and that we did accomplish things, I find that gratifying.
CHC has done an incredible job as a watchdog for the healthcare needs of the community, and in the broadest sense too, not just, enrolling for health insurance, but just what are the health needs of a community, nutrition, physical exercise, all of those needs. And CHC has been in the forefront of advocating for the rights of the community for those basic needs.
Community Health Councils is essential in bringing the community leaders together. Oh, you do that? Oh, you do that? You do that? Can we help each other with that? And that's the way it proceeds. No one institution, no one leader can do it. We have to pool our resources. We have to pool what we know.
We can't do this by ourselves. We're not in this by ourselves. At the end of the day, it's the people in the community who live here who have to carry on and make sure that today's problems are not tomorrow's problems. They have to make sure that what has happened in the past doesn't happen in the future. And that's not our job, that's all of our job. And so it's a collective effort.